I think that a lot of people bring many skills into the profession, but what we teach in social work school is for people to use their skills in the context of the values and the tenets of social work practice that we teach.
It's about collaborating and partnering with individuals, groups, families, communities, to address issues that they identify that they'd like to see worked on. And that's what we do, is we partner with them. We don't act like the expert, even though we get referrals sometimes from different organizations. It's really, our job is to facilitate the process of change, whether it's with individuals or whether it's more with policy, trying to make social justice happen.
One of my favorite definitions actually is not the formal one, but it is helping people to get out of their own way and the way of others, which I actually really like, and I think it fits. It's helping people in groups and communities to achieve their potential insofar as they can, and a large part of that is eliminating barriers of all kinds. And many of those barriers are societally imposed, and so we do a lot of work at the macro level as well as the individual level that people often think of when they think of social workers. People have more misconceptions about what social workers do than maybe any other profession. And I remember asking students one time in an intro class, what do you think of when you hear social work? And the answer was, aren't those the people who hand out cheese? And I thought, well, in the old commodities when we used to do that, and it is very true that we do that very kind of direct work in helping people connect with resources, but we also work at many other levels as well. I think addressing poverty and social injustice and oppression are key to not only social work values, but key to social work focus regardless of what level we're working on, whether we're working with an individual or with the federal government to advocate for people.
Well, I see social work as a helping profession. And by that I mean that we are trained social workers in order to help individuals, groups, families, communities, and the global economy, the global community too, with social work practice, policy, and research. And we also follow the National Association of Social Workers Code of Ethics in that work. And we do not work as an island. We work with other collaborators, whether they be volunteers, key stakeholders, other social workers, legislators, clinicians, agencies, organizations, school systems. So we are in there in the community trying to identify problems and also address those problems. We may not resolve them completely, but we hope to build on the strengths of people and their surroundings in order to help make lives better.
Awesome.
And throughout our curriculum, we work with students on the Code of Ethics. That is a set of rules where we treat our clients with dignity and respect, where we are aware of our strengths as practitioners, and if we do not have the area of expertise we need, then we make proper referrals. We stay within the promise to continue to improve our professional development through whether it be licensure and getting continuing education credits or continuing to learn about an area in which we work, things of that nature. And so that drives our practice.
What is social work? I mean, you've got the textbook definitions of what it is, but I'd have to say that personally, the definition that I have has grown and sort of changed as I experienced different parts of social work. I think in the beginning, when I was exploring social work as an option when I was a student here, my mindset was social work is clinical practice. I mean, that really, in the truest sense, the direct practice, one-on-one, providing therapy or counseling type services. And that's where my definition began. When I went to school, and I went to a very clinical graduate program, is that it stayed within that, but then there were folks that were kind of planting seeds for that social work definition to expand and to go beyond the one-on-one, and to enter into policy, to enter into more self-help. Instead of me being an expert, think about, well, how can I help people realize the expert from within? How can we help people make changes on their own? And part of that came from, as I experienced different elements of social work through my practice, as I experienced different social workers themselves and interacted and the influence that they had on me, that definition began to change. And also some of the frustration is that, and I think other mental health providers and even medical providers realize that we can't make people change. That's the reality. And so social work's kind of wisdom is, how do we help people, how do we empower them to make those changes as opposed to dragging them through the change process, was kind of an epiphany for me, and thinking the frustration of not being able to see change in all of my clients. Well, how can I do things that will be perpetual? You know, at policy level, it's kind of perpetual. Once you design it and implement it and you have it, whether it's a program or even a statewide policy, is it creates a life of its own and has a magnitude more than just the one-on-one interaction. So social work, my definition, I guess, has kind of gone from that interpersonal, we help people help themselves, to, we help communities, we help organizations, we help states help themselves. So it's really kind of gone from what we do is in the one-on-one type session to a much broader scale.
The majority of my career has been in medical settings. I've worked in all kinds of medical settings, starting in a general hospital environment, moving into rehab. I've done hospice, I've done home health. I even did a short stint in Gera Psych. And bringing the same skills and the same value set to lots of different situations. When you work in a medical setting, for the most part, you are working with people at least in their 50s and most of the time geriatric. And that's where my love of geriatrics or working with the older population began.
Well, I first got into social work. I was working. I was working with developmentally disabled individuals, and kind of fell into social work that way. I actually had a bachelor's in geology and wasn't able to find a job. It was right in the middle of the oil crisis, so I happened to fall in working with this wonderful group of people, and I just loved it. And I thought, oh my gosh, this is where I should have been all along. And so then I was able to get a case management position, and then I decided to go back and go to graduate school, and that's when I went back and got my MSW. And after that, I worked in a residential treatment center with children. Did that for a couple of years. Then I did community mental health, and then after that, I worked with dependents of active duty people that worked with the Air Force, and so I worked with all the children and the spouses of the active duty.
I've worked as a medical social worker. I was on a trauma team at a hospital. Did some work in inpatient and outpatient psychiatric unit. Did some work as a co-facilitator for a psychoeducation